Hello, everyone. This is Lynn Cremando for YogaUOnline, and I'm so pleased today to be here with Lillah Schwartz. Lillah is the author of the book, Healing Our Backs with Yoga, an essential guide to back pain relief. She's been teaching and practicing yoga for over 30 years. She had the honor of working with BKS Iyengar and some other very senior level Iyengar teachers before she kind of broke off on her own. Lillah has a varied background, and it includes body work and cranial sacral therapy. So that adds a real dimension to her depth of knowledge of anatomy, kinesiology, and physiology. She stresses a lot of alignment in her work. And of course, she does a lot of work with her clients and her students and her student teachers in talking about back pain relief. I want to talk to her about something a little bit different though today. So welcome, Lillah.
Hi, Lynn. Nice to see you again.
Good to have you here. So here's what I want to talk to you about. I've noticed in my classes and in my reading that quite a few people who are coming into yoga now new are not the sort of agile 20-something skinny people, but in fact, it's people over 50 who want to retain function, who want to retain, they're not ready to hang up their dancing shoes or their hiking shoes or their bowling shoes or their skiing shoes. They don't want to be acrobats, but they want to retain function. So can you first talk about this, because I know you know about physiology, a little bit about the physiology of aging and what a 50-year-old practitioner coming into a yoga studio, how do they differ from a 25-year-old?
You know, it's having been teaching for actually 38 years and still teaching. And it's wonderful. I have a couple classes that I teach regularly. And in one of the classes, my age range is from 50 to 82. And the other class, I would say the age range, I've got some 25-year-olds as well as some 55-year-olds in that class. So and I currently am past the 55 mark. We won't say how far. I'm not retiring yet, but I am well into my 60s. And especially when people enter their 60s, they start going, oh, if I'm going to do an exercise, I need to do it carefully. I need to do it with some wisdom. I need to do it with some understanding because I don't want to hurt myself. And so that's an interesting place that they come to. And the difference in the body types is that a 25-year-old, their fascia is soft and supple and it moves, and it doesn't take much for them to gain flexibility. As a matter of fact, they need to work more on stability as part of their yoga focus than flexibility sometimes. But then you come to someone who's 55, 60 years old, and the neck and shoulders are locking down and the hips are kind of locking down. If they get the hips loose, the shoulders are still kind of tight, and the fascia is changing. You know, the fascia is getting drier. It gets drier. It gets less resilient. So it does change, but it doesn't have the, what's called in the industry about fascia and the knowledge about fascia, it's called crimping. When they take pictures of fascia, and it has to be done in a wet specimen because it dries out like that, right? And it's gone and you can't see what's going on with it because it's one cell thick and then layers and layers and layers and layers. It's like having baklava. You know, you have to it takes hours to layer all the layers together. So, you know, that kind of thing. And when a person is young, the crimping is really steep. And as a person gets older, it gets longer and longer until it almost flatlines. And that's the resilience in the connective tissue, which is how we're strung together. You know, we're not just a muscular body, we're muscle fibers and connective tissue, and that is how we're strung together.
Can I just break in, because I want to
Sure.
ask you to expand on that a little bit, because it isn't simply fascia, right? It is also sort of the gel in the inner vertebral spaces that is losing fluid, losing moisture. In other words,
Right.
moisture is coming from other tissue. When we're talking about fascia, sometimes we're just talking about the sheath that covers every cell, but really, if we want to talk about connective tissue with a bigger scope, aren't we also losing fluid from other places, for example, in the spine?
In our joints, any joint. The spine is 26 joints, and yes, definitely. And I think that starts actually quite early. I think it's somewhere like 35 years old that the discs no longer get nutrition from circulation in the body. The discs only get nutrition from movement. And so as we get older, we have to also maintain movement, because if we don't maintain movement, there's no fluid going into any of the joints, not the shoulder joints, not the spine, not the back of your neck, not your knees, not your hips. Across the board, that's the case.
So someone who's, not to cut you off, but someone
ahead.
whose lifestyle is naturally becoming more sedentary, which is often the case, or you've been sitting at an office desk job for 30 years rather than teaching yoga, at the very thing that you need to retain that resiliency is movement, and that's the thing that you're cutting back on.
Exactly. And oh yes, if we could just find it in our schedules to do a little bit of yoga, it would be so good. Yeah, and because there are specific ways that you can loosen the fascia, open up, create some fluidity, some circulation that are not harmful or overly strenuous. Yeah, so there are ways that you can do that where it's not overly strenuous, so you don't have to super tax the body. You just have to get in there and start some movements and start paying attention to how your joints are feeling, right? So whether it's just this year, you know, most people think of back pain as being in the lower back, but it could be the dorsal, the mid back, and it could be in the neck. And this past 6 months, I've been healing a shoulder injury that actually came from my neck, from being at the computer much more. I've got it worked out now. I've got my desk set up just right, and I've got the chair just right, so I know how to make the variances. But I had picked up so much tension in the fascia at the base of my neck that I ended up creating an injury in my shoulder. So often people say like, oh, my shoulder hurts, or I can't move, or I can't lift my arm. And it's coming from how the fascia and the muscles are connecting from the neck out. You know, or someone gets older and they say, oh, I'm getting arthritis, my thumb hurts, my thumb. Well, if you trace it back, if you look at the anatomy trains that Thomas Myers has been so wonderful in educating us on, you can follow that train all the way up the arm to the back of the neck. Injuries can be healed. Soft tissue injuries, fascial injuries can be healed. You just need the right movements and the right poses to get you there.
You were talking about the top of the back at the lumbodorsal area where there's that big sheath of thick dorsal. I've seen studies where back pain that can't be tied to anything else, they're now thinking maybe that's, again, that rigidity or that lack of resilience, maybe we could call it, that's coming in.
It could be rigidity, and it could be too flaccid, too loose, too stretched out, too weak. And when it's in the lower back, it's usually, not usually, you can't say usually because there's always a spectrum, right? Somebody could be really tight on one end, somebody else could be really loose on another end. If somebody's sat at a desk a lot, they're probably over at this end where their back is a little looser. It doesn't have, the fascia doesn't have enough tenacity. It's kind of lost its tension and its tenacity. So then their back is hurting. On the other end of the spectrum, you take somebody who's been doing a lot of physical labor. God bless it, we still have people who do physical labor in this country. And they've been lifting a lot, or they're painters, or they're floor sanders, they've been lifting a lot. Their backs are going to be like, rigid. The muscle and the fascia is rigid and hard and tight. So they need to loosen up, and somebody else needs to tone up. I've seen this many times in my back, when my classes have focused on a specific Heal Our Backs sequence or series. You get a woman over here and a man over here, and you got a completely different set of things going on. The good news is that alignment helps us to neutralize the playing field and to educate people about how their bodies actually move so that they can learn to move safely and know what their intention is in a particular stretch.
So I always think, first of all, that movement itself, locomotor movement, is originating in the pelvis, in the sort of the lumbopelvic hip complex. But the movement, non-locomotor and locomotor, there's a huge involvement of the spine. You have to talk about the spine. So what are the elements, would you say, of a healthy, at any age, of a healthy spine?
The first thing we have to have in our spine is suppleness. So the spine is what makes the human being move so freely. That's what gives us the ability to express ourselves when we dance, is because we can move our spine. And if you can move your spine, that means that you're going to get better circulation to not just the spinal structures like the discs and the connective tissue and the small muscles, but also to your organs. Because back pain can go backwards. You can have an intestinal condition and it can show up as back pain. You can have a heart arrhythmia and it's going to show up as dorsal back pain. So it can go both directions. So I think that when people maintain the suppleness of their spine, A, they feel more youthful because they can move easily. B, they have less pain in their body. C, they've got improved circulation, so that naturally follows that they're going to have better function. And I want to add that if there's that suppleness and movement in the spine, it also implies greater self-awareness. So, we don't want to separate yoga completely from the fact that it is physical and physiological. It's also psychological. It's how we respond to our environment, to the demands of our life. And so it's also that aspect. And then it goes beyond that to sort of the spiritual, emotional components, which are also important because that's where all the glands line up, is with the emotional components, right? So the firing, there's some new science out there also, not just science about fascia, but science about genetic expression. How do we have positive genetic expression? And this is something I'm interested in because I have a husband with Parkinson's. So I'm interested in how does he get better genetic expression? What kind of movement, what kind of activities are going to help him to do that so he can function better? And there's certainly elements of the yoga practice that are a great contribution, but there's also more than that. So with that genetic expression, I think that fluidity of the spine also indicates self-awareness, a heightened level of self-awareness. So there's not just this density and I don't know why I'm feeling this way, but there's some other aspect that comes forward that goes, oh, I get it. This is what I was thinking about, blah, 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 and it stressed me out, and now I have this pain in this part of my back or in this part of my neck. So that's part of one of the promises of yoga is it takes it deeper into ourselves. So through the physiology, yes, but also deeper into self-awareness, and I don't want that piece to get left out.
That's a beautiful piece. And the other thing that occurred to me as you were talking is sometimes we yogis are talking about muscle and connective tissue and fascia and all that, but what is the point of the spine is it's holding the nervous system.
It's holding the nervous system.
The neural connection that in a misaligned spine, those missed neural connections is another, not just pain of impingement, but really, you know, where does movement come from is
right.
Impulses right from the nervous system.
From the nervous system, yes, yes, indeed. You know, and a fun little example, I mean, yes, that's true, that's all true. And a fun, something to think about with fascia, I want to go back to fascia for a minute, is eyesight.
Mm-hmm.
Eyesight. As people get older, and this is something I learned from Thomas Myers, and I didn't actually give it a lot of mind until he said something, and it was like, oh, right, I need to do eye exercises, not just downward facing dog pose, not just stretch my shoulders, not just do twisting poses to keep my spine supple. I need to do eye exercises as well, because it turns out that that's where the fascia changes the most quickly and first is in the eyes. And so as we get older, we get to wear glasses because the shape of the lens changes, because the connective tissue doesn't pull on the lens the same way. So it's interesting, fascinating.
It's like a whole body deal, right? And part and parcel of that is going to come the breath, because
yes.
There's a great breath, rhythmic spine. You know, each of those pieces has its own rhythm, but together they have a rhythm.
Absolutely.
Can you talk a little bit about that, and maybe a little bit about the physiology of aging as it?
Sure. I think, you know, rhythm, as I'm aging and teaching people who are older, what I notice is that rhythm, using the breath and using rhythm in movement is really helpful for starting to get the fascia that's all stuck to start getting unstuck and releasing, so that range of motion can improve and more fluidity can improve. Once that occurs, then you have to strengthen it. Then there has to be some way that you actually create some rebound energy in the fascia. So I wouldn't want to just do really passive shoulder movements all the time. These things, you know, these things overhead, out to the side. So there's ways of unwinding the fascia, getting it unwound, but then you want to integrate it and get it really functional again. So then you have to do some kind of weight-bearing activity. So dolphin pose for the shoulders, you know, you get the elbows down. It's a preparation for headstand. You're not going to do headstand when you're 60 years old if you've never done headstand. I mean, I don't see that my 60-year-old students are going to practice yoga enough to build up to a headstand safely. And I'm certainly not going to guide them there. I'm going to give them all the preparations that will give them the functional movement of their shoulders and the strength of their shoulders without necessarily putting them on their head.
I think you just said something really important, and that is sort of the intention of people coming into class. So the people coming into class who are younger may be very attracted to the glitzy, glammy poses. And I know that I certainly loved doing my share of the, you know,
Me too.
the Instagram ready picture poses. But I do think people who are older and a little bit wiser, and I don't think 50 is old. I think
No,
now is 60 is the new 40, but
yeah, 50 is the
and
new
that number's
40.
going to keep going up.
Well, you know, the more people practice yoga,
Yeah.
and the more people who come to yoga sooner, we're going to push that envelope, because a yogic body is a fluid body and it's a healthier body, I think. I mean, otherwise I wouldn't have devoted my whole entire life to practicing and teaching.
But I do think where I was going is that goal of being healthy, and what I like to call it inhabiting your life for the whole range of your life, having the use of your body for your whole length of your body. If that's your intention, your practice really changes to reflect those bits, so that if you're doing the warm-up to headstand, you're getting the benefit of headstand. You're getting the muscular, the physiological, that, you know, you're getting the same benefit.
Right.
But you're just not putting that strain on your neck.
Right, that's the idea, exactly. Start talking about fascia and functionality.
Mm-hmm.
Alignment is really important. You can't study fascia and apply sort of an understanding of the anatomy trains in the fascia without studying alignment. So when I teach people, I teach them basic alignment and movement principles. So what is reciprocal inhibition? How does that work in your body? What does it feel like to create the rhythm of extension? What about holding a pose? What about pulsing in and out of a pose? These are sort of the physiological bits, and they can be varied. I mean, different yoga traditions kind of have a bent in one way or another, but all of them can be employed to help a person really find fluidity and followed by stability, so that they have then functionality, right? So they can all be applied. And once people understand what they are, how to apply them, then the home practice is really important. Of course, people have to practice. And it's important because we're studying yoga, and the idea is to extend and align not just the physical spine, but the energetics of the spine that go all the way to the crown of the head. And we know the limbic brain. When we study about the brain, we know there's the frontal lobe, we know the limbic brain's in the middle, and then we got the posterior. So we know if we're running stress and a sympathetic response, we can feel the tension at the base of the brain. And we know that our yoga poses and breathing exercises that can release that. And so we're going up through the center of the crown. That's the spine. The spine's we're supposed to evolve. We're supposed to evolve as human beings. We're supposed to move past our perceived limitations and evolve. And in the tradition of yoga, what happens with the spine is a reflection of that.
Beautifully put. Now you have a class coming up for YogaUOnline.
I do.
About the fluid spine. I think it's called Restore Your Fluid Spine, kind of what we've been talking about, yoga for back care and healthy aging. Do you want to talk a little bit? First of all, why did you want to teach a class on yoga for keeping a fluid spine? What was your thinking?
It's to serve my students. My students call everything out of me. You know, they want to know, they want to heal, they want to move better, and they call it forth from me. And so it's an evolution of what I did early on in my back book, which still is very valid and important to do, some of those very basic poses, but taking it one step further. what if there's no indication of any disc problems? There's no spurs, there's no disc problem, but there's still an achy back. There's still a stiffness somewhere. It means that somehow the spine is maybe very mobile in one area and very immobile in another area. And so to restore your fluid spine is to bring the whole spine into balance. And there are real specific muscles to work on. And one of them, of course, is the psoas muscle, which people give lip service to, but once you really experience your psoas muscle and how to release it, it's a game changer. It's a huge game changer. You want good posture, you got to know something about that psoas muscle. But it's tricky because it's a mysterious muscle, because it's so deep inside and it has so many connections. But without it, none of us would be standing up straight at all.
There's a posture connection. There's also, I hear you saying, a pain connection with.
Of course, as we get older, that muscle is so powerful. It's part of what pulls us forward as it shortens. And then the scalenes shorten in the neck and starts pulling us forward. And then guess what happens to the fascia in the back body? It gets stretched out more and more and more and more and creates more and more discomfort and pain. So you have to address the front body. If you're going to be, you got to open the front body to be able to work the back body. And that's, you know, and that's sort of the bone density piece. To know about your psoas and create both softness, responsiveness, and strength in the psoas is to then allow yourself to also strengthen your spine. So in the course that I'm offering, we're going to talk about how to create that softness and resiliency, and then how to strengthen as well.
Who should take that course? Is it for teachers, or is it for practitioners, or is it for both?
You know, it's really for both. So the idea is if you're a practitioner and you're 50, 55, 60 years old, you're going to get some clear guidance about how to gradually progress and open and release tension in your shoulders, tension in your psoas, tension in your spine, and then how to return back to creating some stability and tenacity in your spine to keep you upright, and functional, mobile. So it's excellent for that person. It's also excellent for the yoga teachers, because if you're really, if you have students that are coming in that are 50, 55, 60, 65, 70, you need resources to offer them. You need something to offer to them in your classes that's going to really help them. Most people, for instance, don't do a good downward facing dog pose. Their shoulders are totally compromised. They don't know how to get in the right position. There's too much stuckness around the shoulder girdle. They can't get in a good downward facing dog pose. So then their spine can't receive the benefit of downward facing dog pose. So the shoulders have to open up, and it's good for teachers to know, okay, this is a way I could go about that that's going to be satisfying to my students, that they're going to finish the class and do it the best dog pose they've done in 2 weeks. So it's going to help them as well.
I think that's really an important point, because in so many yoga poses, downward facing dog is considered a resting pose,
Home base.
the go-to pose. And people who are either new to yoga or less toned, and they're just following a group class, can really do some damage
in their shoulders.
If they're not prepared for that pose. And it's not a beginner pose. It's not a go-to pose.
It should be, and it can be, but you have to work up to it. So that's the whole idea of releasing the shoulders is that then a person can do a better downward facing dog pose. And it can be a wonderful pose to help extend the spine. It can be a pose to soften the belly and relax the internal organs. It can be a pose as an inversion and bring blood and circulation to the brain, you know, in place of something like a headstand, right? So it really is a pose that should be part of the repertoire, but people just need preparation and guidance to get there.
You know, that's so interesting because we talk about back bends and people think about strengthening the back, which they do, but a pose like baby cobra could be a great way to also open the front in someone who's got inhibition, whose shoulder blades aren't really sliding and gliding the way you want them to be.
And I would, and in the course that I'm offering, I actually prioritize some of those things. So for me, the fascial opening comes first, then the extension comes, and then the tone in the back follows. So, you know, opening the front, opening the shoulders, going into the extension. Just going into a Shalabhasana or baby cobra is okay. It helps the lower back. But most people don't get to the shoulders, right? They don't get that upper back. And that, again, is one of the things I addressed in the course, was how to get to that place where you feel successful about actually strengthening the upper back, getting it open and then strengthening it so you can stand better.
Awesome. What are some of the other things you're going to touch on in the course?
I'm going to touch on twisting poses to release and give suppleness to the spine, and to really, I have some beautiful twists that I'm sharing that I don't think a lot of teachers do, that will really open all the small muscles and help address each joint. You know, you got 26 joints in your spine. So there's 26 opportunities for vertebra to turn 2% each. So it's, you know, we all think, oh, my lumbar really gives me a lot of turn. Well, the only reason why we have that illusion is because the bones are bigger in the lumbar than the rest of the spine. But still, the spine rotates about 2% each vertebra all the way up. And so we want to get all of that being fluid. And so I'm going to address twisting in the course for sure. So psoas muscle twisting.
Yeah, sounds great. Well,
you know, I think a lot of people will benefit from it. My students love this new work that I'm doing. They just rave about it, and classes are big. They keep coming back every week. So I'm happy to share it with YogaU. I'm happy to share it on the platform with as many people as possible and as many teachers as possible. So I'm really grateful for this opportunity.
Sounds great. Can't wait to see it. Looking forward. Thank you so much, Lillah.
Thank you, Lynn.
Wonderful talking to you.
Have a great day.
Thank you all. See you online. Bye-bye.